It is essential that you take precise care when preparing foods and avoid doing certain things when pregnant. This is due to your baby's immune system not being sufficiently developed to fight any infection you may pass to it whilst within the womb. It is believed that a female's immune system may not function at its peak during pregnancy, so it is essential that all necessary precautions are taken. In this video, we will give you a list of foods to avoid during pregnancy. If you are interested in more information about a healthy pregnancy diet and other pregnancy tips like steps for a natural pain-free birth, then click the first link in the description below. You will learn everything about having a joyful pregnancy and a pain-free birth. Contrary to popular belief, yes, it is possible. Check it out after this video is over. Before we get started, if you find this information helpful, be sure to subscribe to this channel and leave a comment below saying, "I subscribed." And what food shocked you the most? That helps YouTube share this video with more pregnant mothers, and help them make the best decisions for themselves and their babies. Thank you in advance. Now, here is a list of foods to avoid during pregnancy to ensure that you have the healthiest baby possible. Listeria. This is a bacteria which develops into an illness called listeriosis. The symptoms of this are mild flu, aches and pains, sore throat and high temperatures. In the more serious of cases, this can cause septicemia and meningitis in unborn babies. This is the worst case scenario. In some cases, many people are not aware they have caught the bacteria as they do not show any of the above symptoms. During pregnancy, mothers have to be aware of certain foods where this bacteria may be prevalent. This is true for after pregnancy as well, especially if you are nursing your child. The symptoms usually develop from 2 to 30 days after eating contaminated food. Cheese. Not all cheeses contain the bacteria, but there are some which can be potentially harmful to a pregnant mother. Avoid both pasteurized and unpasteurized soft cheeses which usually have a surface mold or rind such as brie, camembert, and Danish blue. Also avoid cheeses coated in wax such as Gouda, Port Salut. It is best to stay clear of the majority of blue cheeses such as Stilton, Gorgonzola and Roquefort. Hard cheeses such as cheddar, Parmesan, and red Leicester fall into the safe category, as do softer cheeses made from pasteurized milk such as cottage cheese, mozzarella, ricotta, processed cheese and cheese spreads. If in doubt, play safe and avoid eating it. Eggs. The Salmonella bacteria are most commonly found in eggs. It is best to avoid any foods made with raw or partly cooked eggs such as homemade mayonnaise, meringues, cheesecakes, sorbets or mousses. Eggs are only safe if they have been cooked long enough so that their yolks are hard. Shop-bought mayonnaises are usually safe, as long as they have been made with pasteurized eggs. Always check the label if in doubt. Milk. Avoid all products which have not been pasteurized. All pasteurized products are safe to use all through pregnancy and beyond. Meat. Do not eat raw or undercooked meat or poultry. Also avoid meats which have been preserved in nitrates such as salami, frankfurters, and luncheon meat. Always cook meat so the juices run clear and there is no pinkness or blood within. When touching raw meat and poultry, always wash your hands thoroughly before touching any other foods. Liver contains vitamin A in the form of retinol, which if taken by a pregnant woman can increase her levels far above the recommended daily level and become damaging to the baby. Liver should be avoided, as well as products containing liver such as pate and liver sausage. Seafood. Oysters and any raw or uncooked fish should be avoided. Also shelled seafood such as crab, prawns, and langoustines should be avoided unless they have been thoroughly cooked and are hot. Most seafood bought from a fishmonger or supermarket should be safe. Fresh tuna should only be eaten once a month due to the potential levels of mercury found within. This is also true for swordfish and shark. Tinned tuna contains lower levels, so this is safe to eat every week. Salads. All prepared shop-bought salads are best to be avoided. So too are dressed salads such as coleslaw, potato salad, and Florida salad. It is best to make your own and ensure that all leaves are thoroughly washed free from soils and other deposits found on the leaves. Bonus tip. Pets. It is essential that if you have a pet that every time you come into contact with them you wash your hands thoroughly afterwards. Pets can pass on harmful bacteria that may be present in their feces. You may inadvertently become infected with this by touching your mouth or another part of the body, and this may, in turn, infect your unborn child. Cats are of particular importance due to toxoplasmosis found within their feces. If you have a cat that uses a litter tray, it is important that someone else carries out this task, or if this is not possible then you should wear rubber gloves and a face mask to prevent any bacteria from being passed. This also applies to gardening where fecal matter can be found in the soil. Again, wear gloves and wash your hands as soon as possible after finishing. Toxoplasmosis is caused by a parasite. It can go unnoticed in a healthy adult or even an unborn baby. Once you have this infection, you will not become reinfected and will be immune for life. Did you learn something new from this video? If so, please comment on what you learned. We'd love to hear what you thought. Lastly, be sure to check out the first link in the description to learn more information about a healthy pregnancy diet and other pregnancy tips. Thank you for watching, and see you in the next one.